The gentleman from Pennsylvania.
Thank you, Mr. Chairman. I also want to thank my friend from Wisconsin for his leadership on this very important piece of legislation, and the chairman and ranking member of the Judiciary Committee for working together to bring it to the floor today. The United States is being ravaged by skyrocketing levels of prescription opioid and heroin abuse. This brutal epidemic accounted for more than 28,000 American deaths in 2014. It is destroying families and devastating our local communities. Tragically, our nation's veterans population has been particularly hard hit by this crisis. Veterans suffer significantly higher rates of opioid abuse than their civilian counterparts. And according to some estimates, the number of opioid abuse disorders among veterans has increased 55% in the past 5 years. Worst of all, the death rate from opioid overdose among veterans is nearly double the national average. Clearly, our veteran population has a unique set of needs when it comes to dealing with addiction that must be addressed through specialized programming. We need meaningful and evidence-based solutions, including treatment for co-occurring illnesses such as depression and PTSD. I have been working to help develop those solutions as part of the bipartisan task force to combat the heroin epidemic and by holding a series of roundtables with stakeholders in my district. I strongly believe that the legislation we are considering here today is another step forward in the process. Specifically, the Comprehensive Opioid Abuse Reduction Act will direct $103 million in federal funds towards abuse programs focused squarely on addressing the opioid epidemic. By structuring this funding as a competitive grant program, the bill provides states and localities with maximum flexibility to attack opioid abuse that are unique to their communities. Among other things, states will be able to use the grant funds for various types of anti-opioid programs, including veteran treatment courts. These specialized courts, which seek to divert veterans away from traditional justice systems and provide them with both treatment and tools for rehabilitation, are certainly worthwhile and should be supported. But it is also my sincere hope that we can reach many veterans who are at risk of opioid or heroin abuse long before they enter our court system in the first place. And that is the goal of my amendment. Specifically, my amendment would expand the list of permissible uses for funds from the newly created Comprehensive Opioid Abuse Grant Program to include efforts to develop, implement, or expand programs to prevent and address opioid abuse by veterans. As currently drafted, the legislation permits similar funding for efforts to prevent and address opioid abuse by juveniles. My amendment will simply ensure that the same resources are available to treat our veterans. We have a solemn obligation to stand with our veterans. It is a principle of solidarity. They stood for us. We need to stand for them. Let us keep that commitment today by ensuring that our veterans have the resources and support they need to combat this horrible epidemic. I now yield 2 minutes to my friend from Wisconsin, Mr. Sensenbrenner.